Hi, I'm Nandi. I'm a licensed midwife, a trained doula, and the mother of 3. Welcome to my channel. In this video, I'll be talking about the most common breastfeeding mistakes that I see when I'm working in the postnatal ward. I've been working in the postnatal ward for, could it be close to 6 years now? First as a nurse and now as a midwife. I've taken some breastfeeding courses as well, so I feel that I am pretty good at breastfeeding and have seen a lot of, probably a couple of thousand, if not more, people breastfeeding over the years. So I see patterns where people make the same mistakes, so I wanted to kind of summarize that in a video to give you an idea of maybe you can relate to this when you're on your breastfeeding journey, or maybe you're watching this during your late pregnancy and you want to know what to be observant of. So this will give you some tips and tricks that you can use, hopefully can use along the way. The one really common mistake that I see probably every shift that I work is positioning the baby. So I have a fake boob here, and my assistant, baby Carl, which is, if you might have been in my hypnobirthing group, you have met baby Carl before. He's my 18-year-old daughter's old doll, so I use him for my hypnobirthing course. Anyway, so the most common mistake that I see is that people position the nipple in the baby's mouth. Now, if you do this, what happens is that the baby doesn't get a deep enough latch and will just get the nipple in its mouth. And as you can see, when I squeeze the nipple, it just gets flatter and flatter, and all the milk ducts that come out here get, so think about when you have like a straw. If you bite on it, it becomes harder to get out the drink. But if you just hold your lips lightly, then you can suck whatever you're drinking out. This is the same. So if you bite on the nipple, or if you compress it, then it's going to be harder to get out the milk. And eventually baby probably will get quite frustrated. It gets painful. It can cause sores on the breast as well. So getting a good latch is the most important thing, I would say, for breastfeeding to function. Once you get a good latch, you can breastfeed in whatever, hold the baby in whatever position basically, but it's the latch on the breast that is important. I like to use breastfeeding as the word, also when I speak in Swedish, because it's not nipple feeding, it is breastfeeding, which means if this is the baby's mouth, you want the baby to get a good piece of the breast in its mouth. And this way, when it's sucking, the tongue is massaging the breast, the chin is massaging the breast, and the baby will get a good flow of milk. So to do this, position baby nipple to nose. So I hope you can see this. So instead of placing the nipple right inside the baby's mouth, you want to hold the nipple a little higher than the baby's mouth, so about nose height. This forces the baby to tilt its head back, open up really wide, and when it latches, it gets a very good big latch of the breast. And this way there's a more effective breastfeeding, less pain for the person breastfeeding, and less risk for complications. So this is super duper important, and I wish more people would understand that how important it is. What I see is, even when I explain it, even when I come with a doll and a fake boob like this and show it during calm time, what a lot of people still do is mouth to nipple. It's a little half a centimeter adjustment, but it makes all the difference. So try to, instead of moving the breast and putting it in baby's mouth, just position baby nose to nipple and let baby look for the breast. If baby kicks itself higher, you move baby down. Doesn't matter which position you're in. Now I just showed you cradle because it's easier for the camera, but you can be laying down or whatever. So that is the number one position mistake that I see all the time. Another issue that I see a lot, and I try to help families with, is not noticing the early feeding cues. So baby has early feeding cues, and then it has late feeding cues. If you can catch those early feeding cues before baby gets frustrated and screaming and really fussy and upset, it's going to be easier for baby to get a good latch on the breast, and then also a good start on your breastfeeding journey. So the early feeding cues are usually that the baby starts, if it's sleeping or if it's been laying calm, it starts moving its head, starts licking its lips, doing sounds with its mouth, starts moving around a little bit more, looking, starts sucking on their hands. If you see that, quickly, baby to breast. Do not start changing diapers. Do not go that you need to do other things. This is the little window that you have to get a calm baby to the breast. So if you can get baby to the breast as quickly as possible when you see those early feeding cues, you'll have a much greater chance of having a good latch, a baby that will take its time to find the breast by itself and be a little bit more patient. If baby has gone into that screaming, fussy, upset phase, then it's much harder to get a good latch. Baby will be fussing and moving its head and moving its arms and whole body and be very frustrated. Then it's important to try to calm baby down first and then work on a good latch. Ask the staff in the postnatal ward to show you when they're in the room and they see the early cues, if they say, oh, baby wants to eat, that doesn't mean start doing other things. That's them telling you, pick your baby up. If you say you haven't picked your baby up already, put the baby to the breast right now, because that window can vary. Some babies have a lot of patience and go through those the early cues, and then they get a little bit more fussy, and other babies have seconds. They go through the early cues, nobody picks it up, too bad, screaming. So really try to learn those early feeding cues. There is also, if you Google early feeding cues, there is I wouldn't say flow chart, but there are pictures of a baby that you can look at to kind of get an idea what it is. Another issue that I see a lot is that people don't feed their baby often enough the first couple of days. After birth, most babies are awake and alert and are doing great, and they will take the breast within 1 to 2 hours after birth. And after that, they usually fall asleep. Some babies will sleep a lot of the first 24 hours, maybe most of the 24 hours. Some babies will start regularly feeding right away. And for some babies, they will feed maybe 2-3 times during that first 24-hour period. That why it varies has to do with the type of birth they had, what medications they were used, what kind of personality your baby has, and so on. And there's so many things that affect that situation. But the first 24 hours, if you can still offer the breast to the baby every time baby wakes up, place your baby to the breast. Every time your baby seems fussy, offer the breast. This way you have the opportunity for the baby to latch on. Sometimes they're just fine with kind of licking and smelling and just being close to the breast, and they're okay with that and don't need like a proper feed every time the 24 first hours. But after 24 hours, it's important that they start feeding more often. How often varies as well from baby to baby, but you don't want it to be too many hours of sleep. Newborns have short sleep cycles, and they digest breast milk very quickly, so they will have to eat often. This means that after birth, within the first 24-48 hours, there will be intense feeding going on. Usually that happens somewhere after 24 hours of age. Of course, the baby doesn't know time, so they don't know exact. They will not be like, oh, I'm 24 hours old now, I need to start feeding all the time. But you get the idea. When your baby goes into that intensive feeding period, they will want to feed all the time. They will be super fussy. You can't put them down. They will feed on one breast, fall asleep for 5 minutes or 2 minutes, and then it will continue feeding. They will feed for hours on end. You'll go back and forth between the breasts. And this is when a lot of parents call on the staff and say, my baby, there's something wrong with my baby. Maybe my baby has stomach ache. Maybe I don't have enough milk. Can we give formula? All these things, it causes a lot of stress for parents. And I, as a staff, have seen this. Like I said, I've seen many people breastfeeding and many babies. This is normal, healthy baby behavior. So just put it in your head that day 2 and 3 will be intensive feeding. All the time, maybe around the clock, very short periods of time sleeping. This is when your baby places its order in your body, how much milk the body should produce. And this is why it's so important to, when the baby wants to suck, offer it every time. If it has been 15 minutes since last time, offer the breast. If it's been 3 hours since the last time, offer the breast. Doesn't matter how much time. Baby doesn't know time. Baby follows its instincts. If you can follow baby's instincts, then you will have a good base for your breastfeeding. The milk will come in sooner, and there will be more milk produced, and your baby will be happier and more content. After day 3, 4, 5, 6, 7, you're going to see a difference. You do that in those intense days are usually 2-3 days, and then it starts calming down. So just put it in your head that this is normal. It is to be expected, and it will not be like this forever. This too shall pass. Another thing that I've seen a lot and always has surprised me over the years. So I've worked mostly night shift in the postnatal ward, and it surprises me that so many people say, but when am I going to sleep? Because I feel like the one thing you hear of parents with small children is you don't get any sleep. And this is what always surprises me. New parents think that they're going to get sleep. Unfortunately, once the baby is born, you're going to be team no sleep. Baby will check into its instinct and be awake as much as it needs to be awake, usually needs to feed all the time in the first couple of days. You will just have to follow the baby's cues. And you know the whole thing, sleep when baby sleeps. There's a reason for that saying, right? It is because 24 hours, if baby might sleep a little longer, between 12 and 1 during the day. You don't know when that's going to come. So every chance you get to get some rest, take that chance. Because baby might be awake most of the hours of the day and night. Sleep is different when you're breastfeeding. So you go into your deep restful state much faster and come out of it faster. So if you sleep 1 hour while you're breastfeeding, not simultaneously but as a breastfeeding person, you will get more effective sleep. It will feel like you've slept more. I hear this all the time. Women who have not slept for 48 hours and their partner takes the baby so they can sleep for 2 hours, they feel super refreshed, like they slept a whole night. So just remember that you don't need as much sleep, but you're going to of course need sleep because that's how our bodies work, right? But take advantage of the little times when the baby is sleeping, resting, when the partner is changing the diaper, or so on. You can also learn to breastfeed laying down on the side. This also helps for you to get more rest as well. And the laying down breastfeeding you can do during the day and the night. You don't just have to do that during the night. If you haven't been shown that before you leave postnatal ward, ask to be shown laying down breastfeeding as well. This last one is like 2-part. I can say it's connected. So it's the one thing I always jokingly say, I wish we could write on the walls of the postnatal ward, you have milk. Because the one thing I've heard so many women say over these years is, I don't have enough milk. There's not enough milk. My baby is upset because I don't have enough milk. We have this lack of self-confidence when it comes to producing breast milk. And I'm not sure why. But you do have enough milk. The body is amazing. So you have colostrum, and that's exactly what the baby needs, and that will be produced enough for the baby for the first couple of days, and then the milk will slowly change. So just breastfeed as much as the baby wants, and the milk production will increase. You do have milk. Some women, because they're so stressed, because their baby is screaming and they worry and they think they don't have milk, start saying, but I want formula, can we give my baby formula? And of course, when I'm the staff and I work and mom says, I want to give my baby formula, I said, but this is your baby, you get to choose. But I will still explain that giving baby formula, if I feel that the baby has a good latch, is acting normally, there's nothing wrong with baby, and the mother really wants to breastfeed fully, I will say, I do not recommend that we give formula. I recommend that you continue breastfeeding, because the formula messes up the natural bacteria in the baby's body. Formula is cow milk based, which is harder for baby to digest, which may cause baby to have stomach problems, stomach aches, and might not sleep at all, even if you think